Hello everyone, my name is Liu Letong and I'm working in the Department of Endocrinology in Shengjing Hospital of China Medical University. I'm very glad to stand here to have lessons of diagnostics with you. Today we are going to talk about the physical examination of head. I hope you will enjoy it. The lesson today consists of 5 parts: appearance, eyes, ears, nose, mouth, and pharynx. Before the examination of the main organs on the head, let's talk about the appearance of the whole head. Hair. First, we should focus on the quantity, color, distribution, and the texture of the hair. The first picture is alopecia areata. We can see the loss of the hair on the head. The second picture is psoriasis. We can see some dandruff around the hair. Then we part the hair in several places to examine the scalp. We should find if there are some scar, trauma, hematoma, or other lesions on the scalp. After that, we examine the skull. We should focus on the size and shape of the skull. Several diseases may be caused by the deformity of the skull. First, microcephaly. It is a congenital malformation which may be caused by the premature fusion of foraminal suture, and the skull is very small, so the brain can't develop while the patient may have severe mental retardation. Second one, oxycephaly, which is caused by the premature fusion of sagittal suture and coronary suture. Because the head is pointed like the tip of the tower, so it's also called the tower skull. The third one, square skull, is often seen in rickets or congenital fibers. Last skull is caused by the accumulation of cerebral spinal fluid within the ventricle of the brain. Because the pressure in the brain increased, which will force the patient to look down, we can see white sclera above the cornea, so like the sunset. It's called the setting sun phenomenon. The fifth one is called dolichocephalus, which is often seen in Marfan syndrome and acromegaly. Acromegaly is an endocrine disease which is caused by the excessive secretion of growth hormone. The last one is called deforming skull, which is an euro. Sometimes we see it in Paget disease. Okay, after the examination of hair, scalp, and skull, let's focus on the examination of the cranial organs according to the order of eyes, ears, nose, mouth, and throat. Today, we only talk about the key parts. When we examine the eyes, first, let's look at the picture. There are some landmarks on the picture about the eyebrow, eyelids, conjunctiva, eyeball, sclera, cornea, pupil. At last, we should examine the vision. Pupil is a key part in the examination of eyes. Pupil is the hole in the middle of iris, and normal size is about 3 to 4 millimeters. And conjuncted pupil is covered by the parasympathetic fibers of oculomotor nerve, and dilated pupil is covered by the sympathetic nerve. The pupils are round and of equal size. There are many factors affecting the pupillary size. Under physiological conditions, pupils in infants and old people are smaller. Pupils exposed to bright light are smaller, while pupils in youngest and pupils during excitement or in a dark place are larger. Under pathological conditions, conjunctive pupils appearance in iritis, inflammation, poisoning and drug reaction such as pilocarpine and morphine. Dilated pupils appearance in traumatic intracranial hemorrhage, glaucoma, and drugs such as atropine or cocaine. Sometimes the pupils are not equal size. It's called anisocoria. It is seen in cranial disease, brain trauma, tumor, and cerebral hernia, which is a very dangerous situation. There are two very important reflexes of the pupils, the light reflex and the near reflex. When we examine the light reflex, it's a test for pupillary function. The examiner asks the patient to look forwards and shine a pen light into each pupil in turn. The examiner should avoid shining the light into both eyes simultaneously and tell the patient not to focus on the light source. If the examiner shines the light into one eye and inspects for the pupillary constriction of the same eye, it's called direct light reflex. If the examiner shines the light into one eye and inspects for the pupillary constriction of the other eye, it's called indirect light reflex. We can see the mechanism of the light reflex in the right picture. When the light shines in, it goes through the sensory nerve to the brain, and after the brain receives the signals, the brain will send orders to both eyes to cause the pupillary constriction, cause the light reflex. Near reflex consists of three parts: pupil constriction, convergence reflex, and accommodation of the lens. The examiner puts a finger 1 meter away from the patient. Tell the patient to look at the tip of the finger. First time, move the finger to the patient quickly, and we will see the pupil constriction of the eyes. Second time, move it slowly. This time, we will see the convergence of the eyeball. During this process, we also can see the lens accommodation. After the examination of eyes, let's talk about ears. The ears consist of 4 parts: external ear, middle ear, inner ear, and nervous innervation. We examine the ear from outside to inside. At last, we palpate the mastoid to find if the patient has tenderness. Hearing is the key part here. It's a simple method without instrument. The examiner asks the patient to close the one ear and close the eyes. And the patient puts a finger with the sound ticky or rub from far to near until the patient hears the sound. Record the distance. Do it to the other side. If the distance is same, means that the patient has same hearing of both ears. We also can use the tongue funk to examine the conduction, include the air conduction and bone conduction. The last picture is otoscope. We can use it to examine the middle ear and the inner ear. When we examine the nose, we also examine from outside to inside. We can note the color and the shape of the nose to find if the patient has deviation of the septum. If the patient has influenza or have infection, maybe we will see the conjunctive of the mucosa or can see the discharge. When the patient has hypertension, maybe we will see the bleeding of nose. Paranasal sinus is the key part in the examination of nose. Okay, there is a question. The first question, how many pairs of paranasal sinus? The second question, Which pairs of paral sinus cannot be examined? The answer is 4. 4 pairs: frontal sinus, maxillary sinus, ethmoid sinus, and sphenoid sinus. Only the sphenoid sinus cannot be examined because it's deep in the brain. We can use our both thumb to press the sinus to find if the patient has tenderness. When we examine the mouth, we also examine from outside to inside about the lips, mucosa, teeth, gums, and tongue. Tongue is the key part here. And the different shape of tongue indicate corresponding disease. Dry tongue means that the patient may have dehydration or urology in heavy smoker. Geography tongue means that the tongue is covered by thick yellow coating like a map. Causes is not clearly of geography tongue, may be caused by the deficiency of vitamin B2. Strawberry tongue is usually seen in scarlet fever, and if the patient has inflammation or myxedema or tumor, we will see large tongue. Sometimes the surface of the tongue is smooth, means that the patient maybe have papillary atrophy, which is often seen in anemia or deficiency of vitamin B12 or iron. Herring tongue. The tongue is covered by black or brown-haired coat, caused by fungus infection following antibiotics therapy or in the very weak patient. Okay, the last part, let's talk about the pharynx. The pharynx consists of 3 parts: nasopharynx, oropharynx, and larynx pharynx. The oropharynx also consists of 4 parts: the soft palate, uvular, tonsil, and posterior pharyngeal wall. Tonsil is the key part here. So the third question: how many degrees of the tonsil enlargement? When the patient have inflammation, the patient maybe have the tonsil enlarged. There are 3 degrees of the tonsil enlargement. The first degree it enlarged but within the pharyngeal polytine fold. Second degree it enlarged beyond the fold. Third degree it enlarged beyond the middle line of the posterior pharyngeal wall. Do you remember that? Okay, it's all the knowledge about physical examination of head. I hope you will review it by yourselves after the class. Thank you for your listening.